How about this as an idea?
Yes.
Now, the Constitution sets 3 institutions: the legislature, the executive, and the judiciary. The legislature oversights the executive, makes laws, and represents the people. When people were raising issues and even storming Parliament, and even outside as we're talking, and raising concerns about Parliament, it's whether Parliament is actually living to the ideal, the spirit of the Constitution which creates it. Are you representing the people? Are you oversighting the executive?
Well, we have
even
done.
now with the collaboration.
Yes.
The expectation from this other side, Millie, is it doesn't matter collaboration, whatever you call it, as long as the House of Parliament is actually asking the right questions and oversighting the executive properly. Would you say that you're doing that?
Yes, I would say we are doing that.
Really?
And we have been on recess now for slightly over 2 months. And we had a meeting to prepare us for this session. And I think you notice what covered most of it.
SHA.
Was SHA.
Yep.
Yes. And people are like, oh, parliamentarians are now awake. No, we are not awake. You know, for us, we don't deal with maybe one isolated case. During this period that we went back to our constituencies, you gather the data and you actually discover there's a problem. And you notice members of parliament across raise this issue. I raised the issue. Ichungwa raised the issue. Other people raise the issue. Why? Because we know it's not happening. And we told the parliament, we told the government, you know, sort out this mess. Why? Because if you don't sort out the mess, first and foremost, I'm answerable to the people of Suba North.
Yeah.
If I'm not answerable to the people of Suba North, Ntazama. There are no two ways about it.
I hear you. Can I just push back on it a little bit?
Yes.
On just the rollout of SHA and where we are at right now.
Yes.
Okay. Among the things that the leadership of SHA and the Ministry of Health was responding to was whether they have the capacity to roll out primary health care, to roll out emergency, right? And whether they have sufficient funds for this. Whether they have sufficient funds to actually roll out SHIF itself in terms of the number of contributions. These are things that parliamentarians passed in law.
Yes.
Parliamentarians also allocated funds to these funds, the primary healthcare fund. So when MPs now sit back and ask, but now this thing is not working, you only gave the primary healthcare fund a lot, 10 billion shillings. How was it going to work?
Well, I'll let you know that today the health committee is going to give a comprehensive report. I'd be giving you tidbits because I've not done that comprehensive review, but the health committee will. But from what I could gather from the meeting that we had, they acknowledge that they're having transitional challenges in terms of personnel, in terms of financing. And financing is not about whether we have appropriated or not. We do appropriate. But there's nobody pressing the button for the money to come out. That was a challenge. And I think that is also a factor of revenue collection and availability of financing and all that, which is not really now up to Parliament. Parliament, we have done our part. But I think the more comprehensive report will come out this afternoon. Yes. But for sure, I can tell you, the problem is in implementation. There were many, many issues, and I want to thank the acting CEO. He was very candid. I can't share a lot of the things that he talked with us off media, but they acknowledged that they're having challenges.